Excellent. So I bring you greetings all the way from Los Angeles, California, and SEIU, United Healthcare Workers West, in the Healthcare Justice Division. And so we are eager today, my colleagues and I, to share with you our lessons learned and our experience in organizing through our stories. So just want to remind folks that you can go into the question and answer feature for any questions that you have. We think we'll have plenty of time for questions at the end of the presentation, but if you have questions throughout, feel free to enter them right then and there, and we'll try to answer them as quickly as possible, either through the as a type response or verbally. And keep in mind, I think it's all the sessions have been recorded, and we'll also provide our contact information if folks want to do some further follow-up questions as well. So in terms of organizing through our stories, we really wanted to come here and talk about what we think is the secret weapon of any winning campaign, and that is storytelling and using our own stories. We believe stories are better than facts and statistics. We believe they're better than policy papers, better than opinion on their own. Stories are ingrained in our culture. Next slide. All the way back to the days of cave painting, music and songs. Faith and our religion often tell great stories, political speech, the best novels, radio, film, and television are telling different forms of stories. And of course, in more modern day times, we are using social media to tell the story of our lives and our experiences. And so in the goals for this session, we want to talk about and share the power of story. We want to talk a little bit about the story gathering that we do in the field, tips for story banking, and we'll want to practice some story sharing. So we'll ask all of you to participate and do some reflection. And of course, we'll have time for some question and answer.
We are the Healthcare Justice Division of SEIU-UHW. SEIU-UHW is a labor union, and we represent 100,000 healthcare heroes in California. Our division, Healthcare Justice, is a patient-led healthcare justice organization where people work together to take action to improve healthcare through policy work and direct action organizing. And our mission is accessible, affordable, high-quality care for everyone, provided by respected, valued caregivers everywhere. My name is Lisbeth Espinosa. I'm the field coordinator in the Northern region in California, and my healthcare justice partner.
I'm Elliot Petty. I'm the Southern California field coordinator in our Healthcare Justice Division, where I work to empower both our members and staff.
Next slide. I would like to introduce you to Señor Jose Berumen from Oakland, California. What I would like to do, please take a minute to read his story, and in the chat, I am going to write this question. What in his story do you relate to? And if you can please share what you relate to from his story. Yep, and yes, it's too damn expensive. Putting up healthcare, yes, due to lack of funding. Right, when he really needs healthcare. What in his story can you relate to? During the time when he needed, when you need, yes, healthcare. So, yes, on the patient, frustration, the insurance bureaucracy is BS, being denied care. Yeah, so this campaign right here, this campaign was to increase the reimbursement rates for California's Medicaid program. And in here in California, it's known as the Medi-Cal. So we wanted for the beneficiaries to have more choices of doctors, clinics, and hospitals that would accept Medi-Cal as their healthcare coverage. And the reason why I'm sharing Jose Verumen's story is by Jose Verumen sharing his own personal story with Medi-Cal, he went from storytelling to documenting his lived experience. So by sharing it on a piece of paper, he became a leader in our organization. Previously, Jose did not have a license to share his story to anybody that it mattered to. He did not, it was like, he didn't know who was gonna listen to him. It was a frustration that he had of his own, that he was experiencing. What you see here in his own story, looking at it, you see that there's no facts and there's no figures. There's nothing that says anything about the reimbursement rates or the doctor availability. Nada. His lived experience, his own voice, speaking from the I, that's the facts. Him sharing his story, Jose had a huge transformation. He went from not knowing that he had power in his voice to being an agent of change. Through this action, he created a space for others to share their own stories too. And that's what happened with Señor Jose Verumen from Oakland. What he did was he was able to create a leadership team by collecting more stories in his neighborhood. And he was able to recruit the people that he collected the stories from into his team. So Jose went from, this happened to me, así es la vida, that's how life is, victim to a force of change. A transformation took place through the story collecting of his own story. He's now validated. He owns his own voice, which empowered him. And he had never seen himself as a leader. And now he sees himself as a leader in the organization. Next slide. Why we lead with stories. The action of story gathering and storytelling is our foundation for all of our campaigns, because it's a leadership transformation that takes place in the human being. It's like awakening. It builds connection. It builds understanding. It builds credibility. It brings the authentic voice of the people affected to the forefront. They speak from the I. It amplifies the voice of the vulnerable in their own language and their own culture. It builds storytellers' capacity and skill. It inspires others to share their own stories too. That person looks like me. It builds an organization. As people choose to get involved in direct action capacity. It's essential to winning campaign because we win on messaging, people talking about why it matters to them, and it leads to exposing the issues for the public, and which leads to winning. We are exposing the issues at the forefront, the people sharing their stories with the I, and the public is hearing it. It leads to winning. Next slide.
We'll stay right here.
Yes.
And so going back is dealing with this issue of Medi-Cal and the experience that Jose has had and has to suffer and struggle through, as seems like several of you in the chat have talked about experiences with either yourself or your family with very similar stories. What we found when we were gathering stories about Medi-Cal, in 2016, we actually gathered more than 2,300 stories from Medi-Cal beneficiaries like Jose. Collecting Jose's story, and then Jose going out and collecting the stories of others, people that he knew. And in those stories, we really exposed that Medi-Cal beneficiaries were facing serious delays in care, in which it would take them many weeks, or in some cases months, to get a needed appointment for healthcare. Many were just straight up denied. Clinics, certain doctors, hospitals, just choosing not to accept the Medi-Cal health coverage. Or if it was an emergency situation and you've got a broken leg and you're rushed to the nearest hospital for treatment, if they don't accept Medi-Cal, then you get the big bill, even though you have health coverage. And so through some of this discrimination, people are actually facing different levels of quality when it comes to the healthcare that they receive. We found that some folks had to travel in some cases up to hundreds of miles just to see a specialist doctor. If you live in the Central Valley of California, you might have to travel to Los Angeles or up north to the Bay Area or Sacramento just to find a specific type of specialist, when others have someone very nearby that they get to see very quickly. And we uncovered stories that showed that because of delay in care, but because of denial of care, because of differences, because of the long distance people had to travel, that some people actually experienced premature and preventable death to their loved ones because they couldn't get the care that they needed when they needed it the most. And so I'm going to play for you a video of Ana Lilia and Saul Jimenez, who will share their story.
My name is Ana Lilia Jimenez Perea, and this is my son Saul and my daughter Daniela. Saul has disabilities and illness, but he is a fantastic human being. He's all heart, and he tried to be the most independent person he can be.
I want to be independent because independently I can do so many things. Doing art, music, spending time with my dogs, playing sports. My other hopes and dreams is have a family of my own. The quality of life that I want is, being independent. But having the seizures makes it a lot more complicated.
He has epilepsy, and when he has the seizures, he has grand mal seizures.
Basically on the ground, convulsing like crazy. My eyes are rolled in the back of my head.
It's horrible. I think as a mother, I never can get used to this one.
They put me on a good medication, but then once I was on Medi-Cal, they switched me to a medication that doesn't control my seizures. So sometimes I have to end up in the hospital.
The medical doesn't want to pay for the medicine. They prefer to pay the ER and the ambulance than pay for the medicine he needs.
And usually when I have a seizure or an episode, I sleep 5 days straight. I can't do anything.
And each seizure will damage his health and his brain.
It makes me feel completely useless.
It's so hard with this new medical insurance to get the attention of the specialists he needs.
These different specialists are the ones that are making sure that my quality of life is the way I should be living.
Every time I call to the specialist clinic and I say I want an appointment, they are so nice and they want to give me the appointment soon. As soon they ask me for my insurance and I say it's medical, they say, I'm sorry, we can't accept medical in this office, or you have to call somebody else, or you have to wait or call every 3 or 4 months to see is you in the waiting list. If we continue like that, he never will be completely independent or the most he can be. We need somebody to hear us and help to get a decent care for our kids. They're human beings. They need little more care than us, but they deserve it.
My mom is the most important thing in my life. She's breaking her back. She's doing everything she can. She's the one that keeps me afloat and just keeps me thriving more and more and pushing me to be somebody. I love my mom. I love her so much.
Love me too. We need the people to unite. Somebody had to hear our voices, and we can have the care they need to be have a better life.
So folks like Ana Lilia and Saul and Jose Berumen, they got together, they joined, didn't just share their stories, but joining the organization, becoming leaders in the organization, not just on the Medi-Cal campaign, and by building their own team of folks who are in a common situation as they are and want to fight together to improve these things. And as we'll see in the next slide, we have actually filed a civil rights lawsuit against the state of California. We believe that the discrimination, there's high levels of discrimination against Latinos in California, as the Medi-Cal program, the enrollment of Latinos has become significantly larger, but the funding of Medi-Cal has not increased with the new numbers of people in the program. And therefore it is having the effects that Jose, Ana Lilia, and Saul are experiencing. And so different organizations, MALDEF, Civil Rights Organization, and healthcare clinics have joined us in this lawsuit against the state of California, where we are seeking to get some monetary relief. And we believe that if we solve this problem of discrimination against Latinos in California, Latino beneficiaries of Medi-Cal, we believe that we will solve this problem for all Medi-Cal beneficiaries in California. So Lisbeth is going to talk to us about how we do our story gathering in the field.
So everyone has a story. We can find them everywhere, at people at the students at school, community organizations, community groups, grocery stores, door-to-door canvassing, phone banking your members or phone banking your constituents, digital outreach links. So this is our healthcare justice story form, and I'm going to break down our formula. So the first section of our formula is, as you see here, section 1. It's the basics, which is essential in any campaign. You have the first and last name. We do ask if they are a UHW member. The phone, is it a cell phone? Is it a home? Address, city, zip code, email, and what language do you speak? The second part of our formula, which is so essential, is close-ended questions, which can be answered with a yes or a no, or with one word answer. So for example, here in this case, have you or a family member with Medi-Cal ever been unable to get an appointment to see a doctor or a specialist? Yes or no? Have you or a family member ever been turned away by a hospital or clinic because you were a Medi-Cal beneficiary? Yes or no? Have you or a family member with Medi-Cal waited more than 1 month to get care for Medi-Cal need? Yes or no? Have you or your family member with Medi-Cal ever had to leave the United States or travel more than 30 minutes, more than 10 miles to get care? Yes or no? Has your health or a family's member's health suffered because you were unable to get care you need through Medi-Cal? Yes or no? these closed-ended questions, at the simple yes or no, and in some other cases, a one word, really defines the stories. Like you're able to, like the no's, okay, the no's don't have a particular situation, but the yeses have a particular situation to share. The third part of the formula is the open-ended questions, which require more explanation, AKA share your experience. So the third part of the formula is, what was the original health problem you were seeking treatment for under Medi-Cal? So the person shares their experience. What happened when you try to get care through Medi-Cal? The person shares their experience. So the formula is the basic information in the beginning, the close-ended questions that can really help you see what's coming in and what's not coming in. The third part is the share your experience. So what we're gonna do here, because this is a training, and well, now that we have been living in COVID-19 times and pandemic, we at the Healthcare Justice Division, we went from the actual story form pre-March to a digital story link. So we have now digital story links. So a digital story link can be text to a person on an Android or an iPhone. The person clicks on the link and in their comfort of their own space is able to share their story. And that's been successful. So what I'm gonna do here for the next 5 minutes, I want all of us to experience that. So we created, I'm gonna copy and paste. So in the chat, if you can, so we can all have this experience together, please click on the link and start filling it out. And we're gonna dedicate 5 minutes to this. And I'm gonna show you the process of what's going on. So normally the way we've been doing it before COVID-19, we would be gathering so we collect stories, and our leaders collect stories. So it's, when I say we have a team of organizers, and each organizer has a team of leaders. And the leaders will, you teach one. So for example, like Jose Verumen, like Ana Lilia, leaders learn how to collect stories. They know the formula, and they're able to recruit people because they collect stories, and stories are constantly evolving. They're constantly evolving. During COVID-19, our current time since March, this digital link has been a success because leaders copy and paste and send it out to their network. They posted it on Facebook, their own Facebook. They posted it in their own networks. And people click on it and fill it out, and they share their stories. So for example, the responses are coming in right now. So there's already 6 responses. And the city, Frisco, Silver City, Washington, Waverly, you see the different zip codes. And what I'm gonna do right now, I'm gonna share my screen so you guys can all see what I see. Oh, sorry, I cannot share. But I'll say it. So it's saying the other participant. So what's coming in right now is 66.7% have private insurance, 14.3% have healthcare exchange, Obamacare, 14.3% have employer. So we literally have 14.3 on Obama, 14.3 on employer fund, 14.3 on Medicare, 57.1% on private insurance. I already see the list of insurances. And 25% have you had difficulty getting healthcare since the COVID-19 pandemic began? And I see here 33.3% appointment for primary care, 22.2% appointment with a specialist, 22.2 prescription medication. What's happened with the whole pandemic and us being able to do digital links, what's fascinating, you all, like it's fascinating, is it comes in real time. As soon as that link is texted out, you're able to see what comes in. You can already start seeing the common denominator. You can start seeing the pattern. You can see something that's like, hey, what's going on over there? It calls your attention. So this is very different than when we were collecting stories. When we were collecting stories, it took a minute to bring it in. So we collected the stories and then we turned it in. And here with the digital link, as soon as it gets texted out, people are responding. People are responding. So you're able to see the experiences and what's going on with people, and you're able to bring it back and create change. So Elliot, I think you're next.
All right. So, I would say that, once, as Liz is describing, a part of what we do is as our stories come in, that's really like the first step. And a lot of what we do in terms of, I would say story gathering tips is that we do follow up, right? Because it's impossible for everyone to tell their full stories on a piece of paper or even through electronic form, right? And, some folks are completely new to us. Sometimes we're meeting people out in front of a school and within a community organization. We're meeting them at the grocery stores. We do door-to-door canvas. We might be over the phone and really talking to them for the first time, or through social media. And so, when people are not always as open and eager to share their personal information in this way. And so sometimes what you get on the story form is really just the tip of the iceberg. And so, there's a lot more underneath the surface. And so you want to do that follow-up to get more specifics, to where you can also create understanding about the campaign and where they fit and the role that they can play, and how they can assume leadership by just through their story and by getting in touch with the people that they know, the folks who are in their natural networks, who may also be having the same experiences with similar healthcare coverages. Because we believe that, and so we can add to what's collected on the form. We can go back and do those follow-up. And as we do it, that whole process for us is really documentation, and it's really evidence of exposing the problems and the issues. We would also have different organizations here think about how the story form that you put together, how it might intersect with other campaigns that you might be working on, or future campaigns that you might be working on within your organization. And I'll give you a little example. for us, when at the time we were doing the Medi-Cal, collecting stories about Medi-Cal and thinking about the theory of our case within that campaign, we also, could have taken the opportunity to think about, well, we also want to do something similar around minimum wage, where we wanted to increase the minimum wage in California. At that time was $10. Today, we won a victory several years ago now to increase that to $15 an hour. That will happen over time. But we realized, a lot of the Medi-Cal beneficiaries, the families who qualify at the income level for Medi-Cal, are actually the folks who need an increase in the minimum wage. And so you could have a form that could ask multiple questions and questions that cover both topics. And so we also want to consider how we, as those stories come in and for the long term, how are we creating a database around these stories? And so what Lizbeth shared with us is a Google link, right? And a Google that can create a spreadsheet. And so, but you can go into that spreadsheet and you can manage it and make it what you will. If you have multiple story forms, how do you want to have all of those in one place? Do you want to tag, go in and review all of your stories and tag them that say, okay, this one is talking about can't afford prescription medication. This one, they were denied at a hospital. This one here, they have to travel long distances for to see a specialist, right? And so there's many different ways that you can tag them. So that way you can always, it really helps you to be able to go back to identify people who've had some particular issue. Because when we're going through our campaigns, we have different state legislators that we're talking to, and we're trying to get them to fully fund Medi-Cal, and they have some specific questions. And well, have you met a person like this? And we almost always get that with the news media, who will one day call randomly, and do you have someone who's had the Obama, got health insurance through the Obamacare exchange, and they had trouble having choices in the plan, or they couldn't see a doctor. And so we were able to go back and look at our stories and see what sort of fits, even if that person may not be active with the organization, or they may be, but we're able to go back and pinpoint and have the conversations with those folks about sharing their stories there. And there was a question in the chat room around the providing access and or what's the security and how do we keep things confident. And so we definitely keep this. This is an important feature because we collect or gather the story. That doesn't mean that we can just go and post it anywhere. People are giving their story to us. We're not a health clinic, and so we're not talking to our patients. And so the HIPAA laws in that regards don't exactly apply to us. But one thing that we always do on the form is we actually ask people if they are willing to go public with their story. We ask them why would they be willing to do so. And of course, in anything, if there's an opportunity in the news media or to go to a legislator, right, we're always going to ask them to go do it. We have actually, the excerpt that you saw from Jose Baruman earlier was actually in a magazine that we published, full of stories of Medi-Cal beneficiaries and all the struggle, all the denials, delays, differences, distances, and death that people have experienced in getting care through Medi-Cal. And of course, we ask every step of the way, we ask people for their permission. And some people are closely guarded and private, but others are definitely willing to, let's expose this. This is a way that I can fight back. But we also do like a legal disclaimer so that we as an organization can contact them back, whether that's by phone or even by text message, because we're a labor union and we've definitely got to get that permission from folks so that we can say, hey, the governor wants to hold a special session of the legislature starting in August, and this is our opportunity to come and talk to legislators. Are you ready to go meet with your representative? And so that we can get the word out very quickly through various forms of communication. And so we're sort of checking in with folks on a constant basis. And of course, for the way that we work, we don't just look to gather stories and bank them and go to them when we need them. We actually look to the first step to organizing your leadership, to you becoming a leader, a member in our organization, is through your story. And so every step of the way, we're actually asking you not just to have your story, but for you to actively be involved and lead the way. And so, Lizbeth, you want to lead us on some reflection?
Yes. So now let's share, let's reflect on our training. So I'm gonna add these questions in the chat, and it's already there. So I'm interested in knowing, well, we're both interested. How can you use storytelling in your campaigns? How are you using storytelling in your work? And how do you gather stories remotely during COVID-19? So if you can answer these questions using the chat, that'll be great. So how can you use storytelling in your campaigns? How are you using storytelling in your work? And how do you gather stories remotely during COVID-19? And like this, we can all share, because it's all about, you know, us sharing our information, the stuff that we do, so we can learn from each other. So in the chat, if you can, it'll be great to see some reflections. Storytelling to show the impact we are making in our community, using email lists and campaigns to gather stories through surveys, a script and send it to us, upgrade Medicaid Facebook page and other groups, and then edit them into collective messaging. And you know what, with the Facebook, what we have learned from the experience, if that person, if that leader, that member posted it on their own Facebook network, it attracts more. Also, we've been noticing those things. One campaign was asking who is accountable. Yep. Yeah. Use surveys to collect Stephanie to present at State Environment Agency on behalf of people who were unable to present. And how do you gather stories remotely during our present pandemic situation? I've used surveys to collect, oh yes, Jack, I run an organization that's trying to build power for trans people, and I'm looking to increase engagement. Oh, for sure. Increase engagement, and for them to participate in your organization. to increase engagement and for them to participate with you, with your organization. Reach issue with power so that my community members realize that their own power we can scale. Yes, it's not about we speak for the voiceless. The voiceless, they have a voice. This is great. And currently we're trying to get folks to fill out Google Forms that we promote on social media, but we don't have a big following and are struggling with engagement. Yeah, the people have a voice. So we created performance space on YouTube. I read part of this. Our nonprofit collects oral histories of marginalized populations to build community. I work in the red part of the state, and the histories over half probably simply not acknowledged. Oral histories are used to guide presentations, either theater or musical performance or film presentation. Yes, we have to keep the stories. It's their lived experience. That's the facts. Thank you. That's great. Thank you for sharing, everybody. We have to share what we are doing in the field so we can learn from each other, and we can grow this. It's very powerful that people are sharing their stories and they're at the forefront. Nobody can take away their lived experience. Working on texting, digital link, video storytelling. So Elliot, you can talk about what we're recently doing with video storytelling.
Yeah, so we are going beyond the paper form, going beyond the digital electronic link. But so we're asking, our leaders are engaging folks and people that we know have certain challenges. And so here in California, right, and I guess nationally, there's a big shortage of PPE. And so, you know, being part of the Healthcare Workers Union, we know that we have many healthcare workers who are fighting to make sure that they have the personal protective equipment so that they can, you know, as they put their own selves at risk in the work that they do and the work that we all need them to do to care for all of us when we're sick and when we may or may not have COVID-19, to make sure that they're protected as well. And so we have a number of patients of healthcare who are creating their own videos who are saying basically that, you know, why they feel like healthcare workers should have the PPE that is so critical and necessary, and because, and also like when they go get healthcare, they don't want to be exposed by a healthcare worker as well, right? We also have our dialysis workers who have their own unique struggles in the dialysis clinic settings, outpatient clinic settings, and so they're also reflecting their own videos for an upcoming ballot measure that we have coming in this November ballot. And so, you know, they are speaking from the eye. They are really relatively short videos that are very heartfelt, where people are sort of describing their day in the life, what they go through as dialysis patients, and why they need the benefits that our ballot measure will require by law. You know, and I would say, and I see Hortensia, also our colleague from Healthcare Justice. So, you know, it takes development to be able to develop our leaders, to be able to go in and ask good questions, to go and not just hand people the form and for people to write short little bit of stuff, but to engage in people with a conversation, to talk to people about like, hey, we think there's a big problem with healthcare in California. Here's my problem. Let me share with you my story. Here's the solution that we have. Here's part of what you can do. And so I'm asking you to share your story with me.
Yes.
And so when people have that full context, then people are more willing to open up and share more, put it on paper, and also to get involved as a leader in the organization.
When the person shares their story, let it be the story form, digital link, or the video, they took the action. They're already taking the action for transformation. They want change. They're already a leader. They're already a member of your organization. They're already doing the ask. They're already doing it. So that's the umbilical cord. That's the way you're able to connect that human being to your organization, or that's your umbilical cord. They share the story. They took an action. They want change and they want to be part of your change. The power of stories and the power of speaking from the eye. We shouldn't be, the person speaks for themselves. Give them the platform.
Yeah, definitely. So I see a lot of folks talking about telling their oral histories, a lot of different organizations and campaigns really using the power of videos. What I have seen from other panels and trainings here where people are talking also about stories in different ways and how they may use them. So I think it's very important and for all of us to think of, if you create a story form, what languages that you might need to create that story form in. Here in California, obviously we need English, Spanish, Russian, a few others, depending on where we are doing that organizing. You want to think about like what's the best form? Is it a paper form? Is it an online link? Is it something that you can do on social media? If you have lots of young people that you want to engage, you might not want to have a paper form. You might want to have more of a video, but in a way to guide them and to prompt them on like what are the key things that they want to make sure that they can address. And they'll be very, I think they have a great ability to do things because they're constantly like on their phone, and so that's a great way to reach them. However, if we have older populations that we want to engage, who may not be as handy on the phone or may not have a lot of practice in doing selfie videos, then that's where the leadership development really has to come in, right? Because if we want to expose our issues, if we want to go live, if we want to speak to people where they are at, then yeah, even us who don't do a lot of selfies, this is something we've got to challenge ourselves to learn and to do. So that we can speak to people where they are at, because young people, young voters are looking on their phones. They are tweeting, right? And so they need to be able to see things in that form. Not everyone's going to read your Medi-Cal magazine. They've got to be able to see it in a video format. And so those are all the things that you want to think about as you're creating that. And how do you want to bank, right? How do you want to capture and hold all of the videos that come in so that they don't get lost in the ether? So we did have a few questions that came in. And so there were some questions around the Medi-Cal program. So if you haven't viewed it yet, Medi-Cal is California's Medicaid program, largely for the low income, both adults without children, but certainly those for children. Here in California, Medi-Cal is the largest healthcare coverage for children in all of California. So I believe Medi-Cal is at about 13 or 14 million people enrolled, 2/3 of them children enrolled in that program. And I think our largest private insurer is Kaiser Permanente, which has about 10 or 11 million insureds. And so to really see the size and scale, the scope of what we are dealing with and trying to make sure that people can get really good coverage. So question about recommendations on technology for storing or serving stories that folks are willing to share. So, I think we talked a little bit about the, databasing in a Google form or database. We are looking at database technologies like Salesforce that we can use, which, is a large contact database, but also you can actually input stories there. You can also attach videos to the specific contact records of individual leaders who we would place into our contact database, for lack of a better term. For our video stories so far, we're using Teams, where we can create folders, and so people can share their video just through text message on their phone. On our smartphone, we can save that to a file and then upload that up to Teams, which is a Microsoft program where it's very interactive and many different people can have access to it. You can also, control and provide privilege access to it as well. And I'm sure that there are many other options out there that may work for you as well.
We are getting, well, I would like to give the thank you. And this training is on behalf and in honor to our healthcare heroes that are in the battlefield every day, saving our lives. This is for them. This is about healthcare justice, and thank you for joining. And this is this is an honor for them and for the healthcare heroes who have died in the battlefield and who continue to battle and keep us safe. So thank you all. You have our emails. Elliot and Lisbeth from Healthcare Justice, SEIU-UHW.
Signing off. Y'all have a great one. All right, that's it.